Did you know? Hi, and welcome to Did You Knows? We're back after a couple weeks off for a nice little summer vacation. Hopefully you're enjoying your summer. We around here have taken a couple days off and I will say are having a great time. This week we're going to be talking about our nasal valve. So just as a reminder, if you're jumping into the series kind of in the middle, our nasal valve is that front part of our nose. That's the part of our nose where the side of the nose can come into contact with the septum in the middle or the turbinates in the bottom and can cause obstruction. And so if we have obstruction to the nasal valve, we'll see that by doing things like pulling to the side, called a caudal maneuver, that actually helps you to breathe through your nose better. We've learned from previous episodes that when we have nasal obstruction uniquely at the nasal valve, it can cause things like neck pain, headaches, and back pain, and that by relieving that obstruction, we can actually start to see that those symptoms of pain get better. In addition, we can see that we can sleep better, and we actually have better athletic performance. So today we're going to talk about non-surgical options that allow us to live with improved nasal breathing. So to start with, I have brought along two different appliances. So these are called mute dilators. So this company created this product understanding that sleep is a huge problem in people who have nasal valve stenosis or narrowing, and this can lead to snoring. So they called their product mute to try to capture those folks who are snoring. And so what we see here is that there's little circles. The circles are what are going to go actually inside of our nose. So there's small, medium, and larges just based on the nostril size, and on the website they actually have a sizing guide, or you can purchase a package that has all three options. So what you're going to do once you've figured out the correct size, you're going to want to just put the little circles right inside of your nose, and once you have them tucked inside, you'll see they're going to be pushing your nasal tissue to the side and helping you to breathe through your nose. Taking that breath in, if you've positioned them correctly, you're going to feel a substantial amount of relief. Okay. Sometimes, just the way that our nose is built, or if we have a deviated septum, these can be relatively uncomfortable, and so we want to have an alternative. Okay, so I brought our little nasal strip. This is sold under the brand name Breathe Right Strip. There are also some off brands that are available too, and so you can try those and see if you can save a couple of dollars. Okay, so to start with, I've already opened the package. I'm just going to take the backing off. So on the back side, there's adhesive, and that's the part that actually goes over your nose and sticks. Now inside, we have a little metal bar that's actually expanding or pulling. And so what it's doing is actually pulling the skin out and all of the tissue that's connected to the skin coming out. Again, we see that we get relief. The number one reason why we see people have problems with a Breathe Right strip is that they put it too high on their nose and it just simply can't get down far enough in order to pull that part out. So before you put the Breathe Right strip on, do your test, your caudal maneuver, trying to pull out, see which part of your nose is actually getting relief, and then place the Breathe Right strip there. Now, in the age of wearing masks, we can certainly wear a Breathe Right strip or the mute dilator underneath our mask, and really, for the most part, no one's even going to know what you're wearing. But if you want to look for surgical alternatives, keep posted or stay tuned. We have more videos coming up with education on surgical options, or you can call us today for an appointment and we can go through your nasal anatomy and see what options are available for you. So follow us on Facebook, follow us on Instagram. We also post on YouTube. We are back doing weekly videos again. Post questions in the comments below and we can try to respond to those in the upcoming video series. All right, have a nice week. See you next week. Did you know?